So, hello everybody. I'm going to begin. As you can see, my name is Annette Vernon, and I'm an acupuncturist here in Syracuse. I'm honored to be able to share with you today about acupuncture. Oh, I see you moved back. So, good. Okay, so I'm just going to give you a little history of me. In 2005, I received a bachelor's in psychology and also social science interdisciplinary with a concentration of community mental health. I always have to take a breath after I say that. And I started working in '05 as a mental health counselor at St. Joseph Hospital. And honestly, the reason why I'm telling you this, you're probably wondering why, is because this is how I got into acupuncture. Everyone always asks me, how did you get into it? Well, when I was working, I kind of still work there, but when I worked there full-time as a community mental health counselor, I was working with patients and I seen them come in like they just had mental illness diagnosis, but their physical health was okay, and young kids too. And when they got diagnosed and got prescribed with these medications, I saw a big difference in their health. It went down for the worst part, and they got these chronic diseases like diabetes, high blood pressure, and it just got to me as like these 20-year-old kids, just because of this medication, as a side effect, experiencing these, serious illnesses. And I was wondering what could help them without giving them side effects. So I started researching like Chinese medicine. Well, not Chinese medicine. At first, I got into natural, like remedies, health remedies, and when I got into holistic health, I found like the herbs was a great way to treat somebody and get also to the root of the problem without or any side effects. So when I found that and I was researching for myself, I thought, well, there's got to be a school out there to teach me all this. So then I found the school, and then that's how I found acupuncture, because actually Chinese herbs and acupuncture goes together. So like I said, I found the school, and in 2009, in 2009, I started in 2007, but in 2009, I went away, studied abroad in China, and that was a wonderful experience to see how they use traditional Chinese medicine in their hospitals, in their medical system, and it's very respected, used very commonly, and it's a huge hospital that comes and treats patients with acupuncture, Chinese herbs, and Western medicine too. It's like they do it together. You don't just do one or the other. But that I had that experience there, and then graduated from the Finger Lakes School of Acupuncture in 2011, and today I'm an acupuncturist, and I'm still a counselor too. I do that per diem, and I incorporate that in my practice because I've always believed, because my first love was psychology, I always believed that definitely the mind and body coexist, it's not separated, and what happens with our mind or our emotions affects us physically, and vice versa, what happens to us physically can affect us emotionally. So, and you got to take that in consideration when you want to treat someone. So, is that it? Well, we'll do this. Okay, so history of acupuncture. Acupuncture is a system of healthcare known as traditional Chinese medicine, is what I was talking about, which existed for over 2,000 years. This acupuncture was built upon and expanded for many centuries and continues to grow today. Acupuncture is basically, the definition is inserting fine needles into an acupoint, and it's sterile needles we use one time and we throw away into a biohazard box. And these points on the body are known to give a therapeutic effect. And we are taught these different prescription type of points. So if you come in and say, okay, I have a headache, and you talk to me about what the symptoms along with the headache, like the location, how the headache came about, the frequency of the headache, what you maybe ate, or the weather. I take all that in consideration, and I make up prescription points to help alleviate the pain. It depends. You can come in for something that is like just came about acutely, and you can walk away with that gone. But if you were dealing with something for a long time, obviously it's going to take probably a little bit longer for it to completely get resolved. And how we do this is the intended effect is to increase the circulation of the energy and the balance of the energy, which we call chi. And we're going to talk a little bit more about chi in a second. But in all, it's a painless way to get treated for a wide range of different medical problems. So what are the wide range of different medical problems? Some are respiratory disorders like asthma, bronchitis, nasal congestion, seasonal or skin disorders like psoriasis, eczema. That's supposed to be lipomas, not lymphomas. We can treat lymphomas, but it's it's a cancer. We can help the person along as far as having a more of a quality of life, but I meant to say lipomas with that. But anyway, so it's also shingles or acne or different like heat rashes, all types of boils, carbuncles, all types of skin issues. Major thing that we treat is pain, and some examples is rotative cuff tears, carpal tunnel, tendonitis, mental emotional pain as well, arthritis, chronic pain, acute pain, neck pain, sciatic pain, and upper and lower back pain, and fibromyalgia, and then migraines, toothaches too. Acupuncture does wonders for that, and actually people are starting to use acupuncture in dentist offices when they do dentist visits. Okay. Other conditions treatable by traditional Chinese medicine is depression, anxiety. I specialize more in that. Other emotional issues, other infections, high blood pressure, cardiovascular issues. We can do cancer treatment support and help with addictions like weight loss, quit smoking, and all types of digestive issues. A good example of digestive issues, if you ever notice if you work a lot or worry a lot or think a lot and you have diarrhea, well, that, because of your emotion or how you are thinking or worrying a lot, is actually affecting you physically. So a lot of times if you do go see an acupuncturist and they ask you about your bowel movements, it's not because we're trying to get in your business, it's because it tells us a lot about what's going on with you internally. So also, one of my main things I do specialize is in fertility. There's tons of things that women come in with imbalances that they have that has to deal with them not being able to conceive, like delayed painful menses, or sometimes menses, the period comes on too quick. And it's coming back, and you're like, okay, I want to get that regulated, or you just don't see it in months. Absence of menses, a period, polycystic ovary syndrome. People come in, and they don't want to have to deal with the option of surgery or other invasive ways. So sometimes they seek acupuncture first to see if that issue can get resolved. And we look at it in a different way to treat it. So, and it is really, really helpful. Endometriosis, also, mastitis. Well, when you had the baby, and mastitis, and promote lactation, we can help with that. Morning sickness and postpartum depression. But there's more that goes along with, and you don't have to necessarily be wanting to get pregnant to get treated for these imbalances as well. So how do we treat, and how does it work? It's something called chi, and chi is pronounced like CHI, but it's spelled QI. Chi is the fundamental substance comprised of the universe. And all the phenomenon were produced by changes in movement of chi. So you get it? But basically, chi is the life energy source throughout our body. But it's also, in the universe as well, in the environment. But it basically influences the balance by the stimulation of, we influence it by doing the acupuncture points. And that's how you wonder how does inserting those needles, cause me to not have a headache anymore or have this back pain anymore. It's not the needles that has medicine or anything in it. It's basically activating points that are already in your body and activating those points to move what the substance is, chi. So, and all vital functions of the body are explained by the changes in movement of chi. Chi has different characteristics, and they're normal characteristics, and then there's imbalanced characteristics. So if we study and understand the movement of chi in certain areas of the body and how it's supposed to flow, then if there's an imbalance, we understand how to get the chi to flow the correct way. So what I'm saying is we classify chi as, well, there's more to this, but in summary, 2 ways. Basically what we have, it's like what your cards are dealt with when you're born, what you get from your parents. And it's called, in Chinese it's called yuan qi, and in, you can call it primary qi, the qi that you get. You don't really get more of this type of qi. It's like a reserve insurance, or basically it helps you start off. But when you progress in life, you get acquired chi. And what you want to do is you get the acquired chi through essence and nutrients from food, basically. But the different acquired chi is different in terms of different parts of your body. So if you have zong chi, which is pectoral chi, it's called that because it's located in the chest, and this helps us, have an even flow of breath, and you're not panting, or it's be able to take in the air and let it out smoothly. Yin chi is what we call nutrient chi, and this chi is what it's basically saying is it helps nourishes the body. It helps move the blood through the body so the blood can nourish the body. And then wei chi is our defensive chi, that we want that to be strong. When you come in and get acupuncture treatment, every time you're going to get your wei chi built back up. And that's basically your immune defense. And, acquired chi is what you get after birth. So when we see that there's an imbalance, we try to supplement and make whatever chi stronger that seems to be deficient. So also how acupuncture works is by this theory called the yin-yang theory. This theory was formed in the early 16th centuries. Yin and yang reflect all forms and characteristics of the universe, which basically means in relationship to. So everything in yin-yang it has to have a balance. It has to have a relationship with the two balancing. If we see in pathology or illness, there is an imbalance in that yin-yang relationship. So yin-yang picture. So you guys all saw yin-yang before, right? So the dark part is yin and the light part is yang. But there's also a little part of each in each section. But these opposites oppose each other, but they need each other. And they need each other to check each other and keep that balance happening. If they separate and not with each other, there's no longer life. These are some examples of the relationships that we talk about in the universe. The sun versus the moon, light versus dark. I lost it. Hold up. There we go. and activity and rest. And this is like the body, because there's certain aspects in the organs that are more yang characteristics and yin characteristics. So we learn that and understand that. So if an organ is supposed to act like a yang characteristics, but it's acting a yin, or it's not to its full functional capacity, then we take that also in consideration in how we treat. So hot and cold, chi and blood. This is a beautiful relationship that has to be. That's the same as what I'm saying is they always have to be together. If they separate, there's no more life. How your blood flows is through chi, but chi needs blood to be nourished, so they need each other. So balance is the key. The normal and vital activities of the human body is based on the conditions of yin and yang remaining in balance. So in Chinese medicine, they state that the occurrence of the diseases results from an imbalance between yin and yang, either being in excess or in deficient manner. So to give you an example of the chi of the body, it's a moving and warming function, so that's why it's more characterized as yang, because it's active and it's warmer. While the blood of the body, like I said, is nourishing and moistening, so that's more of a yin characteristic. So, in this picture right here, you can do an activity it's called qigong. I don't know if you ever heard of it, but you can feel that energy of chi if you take the time to focus and meditate. It's one qigong exercise that you just sit, and it's a good meditation actually activity, but you either can sit or stand, like shoulder width apart, and just hold your hands facing each other and concentrate on that. It's like a chi ball, and over time you will feel, and it'll feel like there's a substance in between your hands, and that's the energy coming out of your body that you emit out all the time. So, also how acupuncture works is the 5 phase, and this is also a relationship of balance. They're indispensable material of life. The Chinese look at nature all the time as an example of how our bodies work. They feel that, we feel that we are nature, we're a part of it, and what happens externally affects us internally. So the 5 elements are dependent on each other as the same as yin yang, and they're inseparable just the same. They represent, like I said, human life, and as well as explain the function of the human body and how it changes during diseases. And here's Chinese herbs. I wanted to actually give you guys some to pass around and look at. These are to dispel wind damp. Oops. Oh, that was the clicker. And yeah. Oh no, these are to clear blood heat. So we got, the names are in Chinese, but you can read this in English what they do and their functions. And it's cool to look at because they're all different kinds. So I can have you look at this different, because when you think of herbs, you might just be thinking of like green plant looking type things, but their roots also, their food, and sometimes their animal products. And here, this one too. This one relieves, these bunches right here relieve food stagnation in all different ways. And you can read how they do that. And I'll start on this side. Here we go. But with Chinese herbs, I just wanted to talk about real quick, because they look at the balance of the same way of the body and try to bring the body back to balance by treating it through each herb has like a different nature, flavor, and function. Some go to specific parts of the body and work on the body. Some are like what we call envoys that carry the herbs to help them do the other herbs work to a certain part of the body. And it all depends on what the herb is. Some of them, depending on what they're made, I don't know if this works anymore. Oops, let's see. That's the pointer. Oh, there we go. Well, yeah, it's just a picture. It's just because they're beautiful. But I just wanted to say a little bit because we're just mainly talking about acupuncture. But a lot of I use Chinese herbs. Not all acupuncturists do, but a lot of times people come in with conditions and only or as well Chinese herbs is going to help that condition and get to the root of the problem. So they are a big part of traditional Chinese medicine. And there's other modalities like cupping, what we call moxa bunction, electric stimulation, laser, gua sha, and plena, and nutrition. Health begins with nutrition, so you can't like ignore that. And acupressure. And I'm going to do a demonstration in a second of the cupping and the gua sha and the acupuncture. So let's see what. There's other microsystems as well. There's certain parts of our body that covers the whole body. So the neat thing about acupuncture is you don't necessarily have to use the whole body. You can just use the ears if you wanted to, and you can see like it represents, this is supposed to be a human. Like their head is down here, so this will be the upper jaw, the mouth, the eye, and it curves up, and that's the hand and the hip. I treated someone with hip problems, and I did them locally, but found that when I did a hip point, the pain they had, wonderful results, and the pain went right away. So sometimes you gotta use these other microsystems in conjunction with your regular acupuncture. Fujin is another one. It's what we call the turtle, and we could call it that because it's a picture. It's like a diagram of a turtle on your abdomen, and the turtle, each part of the turtle represents the different parts of your body, and we use that to help treat really deficient chronic issues that people have been dealing with for a long time, and nothing else works. And scalp is like, well, it's for the head, and it's for more, well, you can use it for anything, but it's more for like neurological issues that happen to the patient that you really want to address. So just want to go over how emotions does affect us, and these are all the normal parts of emotion. But in excess, it can cause imbalances in our body. So this is just an example of that, because it can happen and it can cause internal damage. So, for example, if you can get like real angry about something, and you notice that after that you notice ribside pain, or you are belching, or you got just notice certain aches and pains in your body, or notice that it's just you feel like you can't express something out. That's most likely because you festered that emotion so much, it actually had internal damage to your liver. And there's certain functions that each organ does in Chinese medicine, and if that organ gets impaired, it will cause these types of symptoms because it won't be able to do its function. This one is for the heart. Like, even though being overjoyed, because everything has to be a balance. So if you get overjoyed, like too overjoyed, it can cause an imbalance, like a heart attack. I know you probably heard that before, but palpitations, anxiety. You can notice that later on just by having an imbalance of your emotions. So, and it can lead on to a lot of times when you see manic people, it's a heart condition in Chinese medicine. Okay, so I think that, yep, that's it. I'm gonna do the demonstration. I'm gonna start. Whoops, I keep doing that because it's on an angle and I'm setting it down. I'm gonna do cupping first. At this point, does anybody have any questions about the herbs you're looking at or anything? Yes. Yeah. I actually have currently right now a patient. So it's a difficult case, but it's only going to help her if I also incorporate herbs with her condition. She has this skin condition that doctors think it's a fungus. So I treat her. I treat her for, she has other issues too. She has edema and swollen legs and everything. So when she comes in for treatment, I treat her for that, but I can also treat her for the skin condition. But what's really going to get to the root of that problem is internal herbs, because it's an internal thing that's going on, an imbalance. Yeah, so it's not so much even topical. Like, I can do both. I probably will for her, so it can help topically and internally, but it's not something that she can go to the doctors and get a cream for to address that. It has to be an herbal formula to address her issue, which there is, and she's excited about that actually. But yeah, no, definitely, especially my infertility patients or girls that just want to come in and get their menses regulated. A lot of times have to use Chinese herbs for that, and a lot of times anxiety is associated with that, and use Chinese herbs to help with that. And people see results quickly with using the herbs with that. And I have people come in, they had anxiety like every week, constantly, right before, I don't know if it's whatever how their job is, but right before work, like they'll physically feel it, they can't sleep, and they just go through this every single week. And then finally she came in and got an herbal formula, and that she noticed that Sunday night there was no anxiety. So it brings that, it sees the actual problem and gets to that and plucks the root of it, basically. But if my lovely assistant, oh yes, they're all different kinds. Yes, there's some that I mainly like to prescribe granules, and because what you're seeing is raw form, so we can prescribe that. We prescribe it if you want to do it. It takes time to decoct raw herbs, so not a lot of people have that time. So I don't really prescribe that, but you can use that, and it's like you can boil it. You have to boil it, soak it, boil it for like an hour, and then drink the tea, the strained juice, water afterwards. But what I like to prescribe, because it's easier, is granules, because it's already grounded up. And basically you boil your water, and you could just pour the granules in and stir it up and drink and be on your way. A lot of people don't like to take pills, so I don't, like to go that route for that reason, because the herbal formula compliancy will be low. It's easier. Yeah. Most of the time, yes, a tea form, and like I said, they're different kinds too. I was going to show you guys. I'm glad you asked that. This is like a topical. This is a herb. Can you open it? Oh wait, can you open it? This kind is called a burnt cream. And actually, some of the herbs that are going around to cool the blood is in this formula. And basically, it helps invigorate the blood, reduce pain, and heal burns, like quicker. So you guys can see that too if you want. But that's not another form of herbs. So we can take them and make them into an ointment. Yeah, and there's other kinds. We can do put them in the pouches and have them as like compress. It all depends on the situation or what you need, basically. Yeah. But like I said, the most common is granules because that's the easiest way with people's schedule to get them down and get them in. And I say less water is better because it's less you have to drink. Because most of the time they don't really taste that great. Yeah. No. Unless you get lucky. There are some that have like a sweet flavor to them, and you can, like the ones that have cinnamon in it and everything, those are more pleasurable, but most of the time they're bitter. So, yeah. Well, yeah, actually, I tell people you can always add honey. It doesn't hurt, to help get it down. Add the cinnamon, right? And those things, yeah, it won't hurt the formula, yeah. Because I mean, it's better to have it in, right, than not at all. Exactly. Okay. All right. So, does anybody have acupuncture before? No? Oh. Okay. Mhm. Mhm. Yeah. No. Okay. Yeah. Well, no. Qi is a known substance. It's not made up. It's real. It's in your body. And honestly, there's different names for it. Some people call it Qi. Some people just call it life energy source, or with what is it, chakras. It's all really the same. It's your energy. And if you get in tune to that and know how to use it for your health advantage, you'll have a better quality of life. Okay. So, I'm going to do cupping. Let me get that started. Anybody seen cupping before? Heard about it? Okay. It is kind of cool to watch. So, but it's even better to get it done too, because it feels like a deep muscle tissue massage. So. Oh yes, it does. It helps with that. It's what I use it for. Different things, mainly for access conditions, but definitely to help the blood flow. If the person has pain in their back, I could do cupping, and that's going to help increase the blood circulation to get rid of what we call blood stagnation, and that causes pain. So, but we can also use it for cold and flu symptoms to help get rid of that excess of a cold or flu. What else we use it for? Bloodletting and varicose vein treatment. So, yeah, okay. But now I'm going to show you basically if you come, for how many people had acupuncture before? So, okay, all right. So you guys know basically what goes on in a treatment session, but I'll just show you a couple of things that goes on if you come, to my practice. So if I have, you can put that on. Okay. First, I'm going to show you cupping. Kind of like. There we go. I'm going to show you. Oh, that's where you put it. The oil. Anybody experienced cupping before? Yeah. Yeah. Use the fire to make a vacuum in the glass. As you can see, he has from earlier today when I did it, he still has a little bit of bruising. This is normal. You're supposed to have that. It's part of the therapeutic effect. Oh yeah, come on. Come on. It's like like a menthol. Yeah. And everybody has different constitutions in their body, and some people have cold constitution, people have hot. He has a hot constitution, and like a menthol would be good for a person like that. Like what basically like what your body normally is made up of. Like your normal like how you feel. Like when we ask you, yeah, do you feel hot or cold? Yep, yep. Do you prefer warm drinks or cold drinks, or are you neutral, things like that. Yeah, do you curl up in a blanket and everybody else is sweating, So that's your constitution. Yes. Yeah. So cupping does many different things, but a couple of the things. First, it feels great, and it's like a deep tissue massage, and it helps loosen up your muscles. If you're really tense, and you ever go and get a massage and you feel like you got hit by a bus the next day. This helps not have that happen the next day. It helps break up the muscles and relieve the tension and the tightness. Yeah, this is going to be cupping up. But it also helps to relieve what we call access in the body. So if you have an imbalance and you have an excess, sorry, not access, but excess in your body, it helps bring the body back to balance by relieving that. No, this is the least thing. This it feels great. It feels like I said, a real deep massage. It's just like point prescription. It is based on what's going on with the person. He has tight muscles, back pain. With a lot of his type of job that he does, he's doing a lot of heavy lifting and things like that. So this is like definitely the main focus area. Fortunately, it's also an area where I can help if you have like sinus issues or cold flu symptoms, if you feel like you're coming down and you have like a sore throat or you're coughing or just phlegm and congested. These right up here represents for the lungs, and it helps open up the chest. So at the same time, I'm doing a dual. But that's the way it is a lot of times, The suction, yep. It's the skin. It depends on how hard or that and how intense the pressure is, because you can, depending on the heat, you can gauge the vacuum. So if it's sucking real hard, it's bringing everything up. But if I just have like a soft vacuum, it's just the skin that's bringing up. But see, it's bringing up this is what we call Sha. And sometimes Sha, yeah, this is like the blood stagnation. We're help getting that to circulate, and that's alleviating the pain. A lot of times people have injuries and they have deep internal bruising or pain. This brings it up to a level where we can work it out. And that's a lot of times what, compared to massaging, and just massaging, it didn't completely address the pain or the issue. Right, this helps it, gets it to the deeper level, yeah. So, and this is called slide cupping. There's all kinds. I could just have the cup sit there and retain it for a couple minutes or about like 5 minutes, and come back and you see like it's getting darker. It's coming up. It's bringing up the stagnation. So you can do that, or flash cupping where it's like I'm constantly taking the fire and putting it on there and bringing it up and taking it off. That's a coordination. But it's used to relieve or get rid of the excess of the blood stagnation can cause that, or like I said earlier, what we call our evils, that we call like different evils that invade the body, like dampness, heat, like in these things, if they're and if your body is not in balance or able to fight it off, and when it tries to come and invade, this is you. Yeah. Right. Right. And it's doing the slide in there, because I was hitting the other one, and that's coming up. No, it's thick glass, and these are small ones. There's bigger ones, all different sizes, but no, you do it all over the body, Plus, we also use this for bloodletting, and that helps alleviate pain, and we use that for spider veins. So, yeah, varicose veins, spider veins. And you can come just for, if you just say, okay, I just want to get cupping, this treatment, or I just want, spider vein treatment or varicose vein. Or some people come in, I have one patient who alternates. She comes 1 week for plana body work, and then the other week she gets acupuncture. So it's all different. Yeah, at the Spa 500 on West Onondaga Street. So yeah, that's on Get Good. Oh, I can give you, I can email it to you. I don't have something today with all that. So, the first session is $65, and every follow-up visit is $55. For me, everybody's different. You have your own discretion. I was about to say that I take Palmco, and if you're Excellus, if you have that, if your personal policy, even with Palmco, it depends on your policy if it covers it. We have to find that out. But yeah, I'm in network so far with Palmco and Excellus. Palmco? United Health? Yeah. Yeah, that's another one that yeah. Yeah, it depends on, yeah. Yeah. So yeah, it's all different. Sometimes you gotta pay a copay or not, or sometimes you gotta pay all up front and then get reimbursed. It's all different. So it depends on what you're experiencing, what you're going through. If you just, all of a sudden had a headache that just started that day, you want to come in and get treatment, it's resolved, and you don't have to come back for that. If you've been experiencing the headache for at least 3 months or more, then you're probably going to need at least 5 sessions, I would say. If you have something that you've been dealing with for a long time, generally we say 10 sessions is what you should do to come to the result that you want. Usually people see results from my experiences by like session 5, and what I do with them, if they are starting to get better and a lot of the symptoms are alleviated and decreased, or completely went away, I decrease their the times that they have to come. Like, they won't have to come every week. They can come every 2 weeks, or come every once a month. Or some people like to do come for just like wellness, and come like 3 times or 4 times a year with the season change and get that boost. Acupuncture is very good with strengthening the body and strengthening the muscles and the legs. Somebody was talking about earlier about having weakness, muscle weakness. Can you uncross your legs? So it's good to have. Don't ever like cross your legs, because we need free flow of the body. So when you're getting treatment, so. But But yeah, it can strengthen, like I said, your muscles. There's a old story in traditional Chinese medicine literature about like the old warriors, and they were walking for miles and miles and miles, and they were so tired and they couldn't walk anymore, but they needled a point on their leg. It's like called Summit 36 is the name of it, but basically they needled that and they were able to walk at least 3 more miles more. But I'm didn't do this earlier, but I'm gonna show you a little bit of matza too, and it's a burning of a herb called, well, in English is, well, if it's grown here, it's called mugwort. If it's grown in China, it's called ayes. And this is one form of it. There's all different forms. This is, yeah, matza. Oh, there's 2, because, you know, if you're in a facility, which I hope this is fine, if you're in a facility that you can't have smoky, because this one gets kind of smoky, then you use the charcoal kind, because that's called smokeless. And it still can give you the therapeutic effect. But I like this better because smelling it gives you a therapeutic effect as well. So, here are, I wanted to show you. If you want to look, this is loose matza, and be careful. And this is like stick-on matza that we stick on the body and burn. And then these we make into, it's like a, it's loose. It's like, not like a powder, but yeah, there are stickers on, is adhesive on the back, and we'll put it on the different points of the body and light the top. And we make a wish, yes. Yeah, we make it into a cone. We roll it and make it into a cone shape. And there's like different barriers that I do in between the body. It could go directly, but they mainly do that in China. It's called direct masa, and their intention is to have some type of scarring on the body, and it's very therapeutic. But not a lot of people in America are that hardcore, so we don't do that. But this kind I'll just place over the body, and this helps warm and invigorate the qi and blood. So once again, help circulation and help alleviate pain if there's any blood stagnation or qi stagnation. Yeah, the mugwort, aye. Yep. It's the aroma and it's the heat itself, because the herb is actually penetrating and helping. Because heat, you can do heat's gonna move and make things move. That's his characteristic. It's young, but this goes on a deeper level and does influence the qi and blood. So, yeah. Yep. And someone asked me earlier, is there any stage or steps to how I do it? Do I do kneeling first and then the cupping? It all depends. Some people need the cupping first to help open up because they're so tight, and then I go in and needle. A lot of times I do needle first and then do maybe cupping, and then most of the time, actually, I masa while the needles are in, and that gives it a deeper effect as well. And then there's needle masa that you see the loose ones right there that we can put right on the needle and burn it. And that's a deep warming penetration of heat. So, okay. So next I'm going to do actual needle. This is for to alleviate the muscle pain. Yes, upper and lower muscle pain. And this time I didn't do this earlier, but I put one here to help with the lower back as well. But also, like I said earlier, he had like nasal congestion, stuffiness, and we help alleviate that, so he breathes. And so I'm just reinforcing that treatment by needling up there as well. And different, depending on the area of the body. If when there's more, muscle mass, you can go deeper. If it's thinner, to like I can go. It all depends on actually how you needle too. Here I can needle perpendicularly, and it's all because of the anatomy that's lies underneath. But I'm counting vertebrae to find a point that I want. He usually jumps when I do this point, so yay! I always forget that, and then that's why I was laughing. I'm like, I'm doing the exact point that he always jumps. But good. So this point is to help the kidneys. Yes, it's a guide tool. You can do what we call freehand without the tube. I like to. There are places though that I don't use tube, like on the head or for some certain spots on the face. Yeah. First we wipe the areas where we're going to insert the needles with alcohol wipe. And find the location. No, it can if you wanted to go that deep, but pretty deep to. It's going under the superficial layer of the skin. We go right past the top part where all the nerve endings are, and that's why people don't really feel the needles, because once you get through that, especially while the needles are being retained or inside, you don't feel them. What you feel is a sensation. I don't know if the people who had acupuncture, if you guys felt different sensations during your treatment. You did? Yeah. What did you feel? I'd like to know. Right. Right. And at most, it was like a mosquito bite type. Yeah. And it's mainly also the anticipation of knowing that someone's about to insert a needle in you is the worst part, really. So if you can get past that, you're golden. So I didn't like the positioning of it, and with this body type is very muscular, and the muscles didn't allow it to. Yeah, I can tell by looking and feeling, and it just wasn't going straight. Oh, well, yeah, I locate the point by certain landmarks of the anatomy that we learn. So, bones, muscles, and, depression of the body, and we count. Like, there's measurements with our hands. If you see me doing this is what we call 3 sun. And each location, 3 sun is like inches, and the locations are described by 2 sun lateral to the, midline of the body, or, 0.5 sun. So all different measurements. Oh, something else I was going to say. Oh, we also, as practitioners, do feel the chi. We feel the chi move to the body. We're searching for that. And sometimes we manipulate the points or the needles to get the chi activated. And for us, it kind of feels like if you ever went fishing and the fish bit the hook, it's like that type of feeling. We're like, okay. Usually, especially in certain parts of the body, we might manipulate, and different manipulations are to supplement or to take away and drain, basically clear out, clear heat. When people experience that and manipulate it, if they have a reaction like a oof or like or whatever type of reaction, we know that the chi is activated and they feel that. So yeah, because it's the energy that's connection, and I'm being a conductor of from the source, basically, of energy to help facilitate the treatment. So, and you're supposed to, because it does flow, and if you don't, and I've been a victim of this sometimes, if you don't focus and do that, you can get the energy caught up in you and actually take on what the person had, you know. And a couple of weeks ago, I treated a girl who was congested and couldn't breathe, and I treated her, and she felt great the next day, was so happy, and told me, but I couldn't breathe. And I was congested, and I was like, great. I sound like, I lost my voice, and somebody thinking I got bronchitis. I'm like, it's not that deep, it's not that bad. Yeah. Yeah. It's a lesson that teaches you every time. So one time I got someone's headache, and I rarely am a person that gets headaches, so I know it was probably that. So it's hard. I mean, you get caught up. I'm a mom. I work, and sometimes you get caught up with life, and you don't take the time yourself. And if you don't do that, that's when you're vulnerable for those situations. So me too. But normally I would do both sides because these points lie bilaterally on the body. I can do this one, but I like to be on the other side, on the other side, but I won't do that today. But oh yeah, I wanted to do down here. And if you just feel like you're low in energy too, you can come get treatment to help boost your energy. Or if you're too high strung, you need to relax. A lot of people, they don't know how to relax, or they don't know how to let go of certain things and release. Sometimes your body harbors emotion, like I was talking about emotions, and acupuncture really helps that release to happen. Some people, and they feel embarrassed by it, but they shouldn't. Sometimes they end up crying during treatment, because of the emotional release that happens, and it's just a reaction to the treatment. That's all. Yeah. Actually, and some person actually went into a fit of laughter one time, so. But yeah, just gotta help it. Yeah. So after I would insert all the needles, I would leave the room, and there's like music playing, and you can, zone out and let what I call the needles do their work as far as influencing the chi. And I would leave for about maybe 5-10 minutes. And overall, the needles were retained for probably 15 minutes, and then I take them out. And then once I take them out, I would do probably, it depends. Not everybody gets body work. It's not always calls for that. Not every session calls for all these different modalities. Depends on what's going on with you and what you need. And, Chinese medicine is about that. It's about being simple and just what you need, not, everything to access. But certainly you can, like I said, if you wanted to just try one of the different things, there's no harm in that at all. But the effect you get if you just come for a regular treatment and I assess you and see what you need, and see me, like, when I do the needle, also do maca or cupping or whatever, all that combined, just you'll walk away with results every time. Anybody have anything that I didn't address that you might want to know if acupuncture treats it or not? What's that? Mhm. Right. Yeah. Yeah. Definitely. And that's a good one, because we do look at it a different way than Western medicine do, and we know that there's different mechanisms that cause the pain, and we find that root and address that, instead of just you saying you have rheumatoid arthritis and here's a medication for it, without looking at you and individually, and see, and also taking into consideration your constitution and everything involved with that. That's how we can treat that. There's what we call wind damp feet, and that's something people experience if they have arthritis. And if they have that, what they notice is every time it rains, they're in pain. Then that's something different going on than just degeneration of the joints or inflammation of the joints. So. Right. Right, right. But with acupuncture, how it helps with the immunity of the body, it helps build the body back up. It's not something definitely overnight. It's over time, but it definitely can help alleviate the symptoms that we call branches. While we're trying to get to the root of it, we can alleviate the branches and the things that you're experiencing, day to day. So, what was somebody else? Right. Mhm. Right. Yeah. Mhm. Right. Yeah. And is it just your lower limbs, like your ankles or your feet? Yeah. And do you feel cold? Cold feet? You feel hot? Okay. Mm. It definitely can help um, increase the healing process. And I have to ask you more questions of what's going on, because it sounds like a pattern that's going on with you, but it's complicated. So, yeah. Yeah. The swell. You said it's just swelling though. It's edema. Okay. Oh, okay. Oh, so it's something that happened after surgery. Okay. Yeah. Yeah. Yeah, that sometimes that is the effect after surgery. Ah, okay. Yeah. Yeah. No, because of what acupuncture does, and it helps circulate and remove, the buildup, because it's moving the body, circulation to the body. It can help that just by doing that. It's definitely acupuncture if you, I mean, seek it if you think you're about to go into surgery, or seek it after surgery because um, it will help your body recover. It's an, intrusive, invasive type of treatment, surgery, and usually, yeah, people do experience, side effects just from the surgery itself. So, uh, varicose veins is basic, well, the same for spider veins. It's a lancet. I don't have it, but we use a lancet and basically tap the skin, and then we take the the glass cup and make the suction and place it over there. It draws up the stagnation, the blood, and then we go from there and smooth it out. It's not something that if you have a lot of, we take care of all at once, because that's too invasive. But over time, if you're experiencing pain with it, is that the problem? Then I wouldn't necessarily. I usually do it with people who they're like huge and they having a lot of pain from it. Okay. You just don't like them. Yeah. But yeah, if it's uncomfortable experiencing pain, then I usually treat it then. Okay. The last thing is the body work that I'll do. So if you, like I said, if you have chronic, back pain or just back pain in general, this is some of the massages that I would do. It's called plana, and basically it's just a technique of pushing and pulling, because that's what plana means, push pull. So it's just little. I think. Alright. A lot of people, a different way of massaging can help alleviate the pain and increase, circulation. Oh, guasha. I didn't do that yet. Guasha is a scraping of the skin. Scraping. Yep, it's a scraping of the skin. But it's with a smooth ceramic tool. And it's the same concept of cupping as far as, reducing excess stagnation or evils, or help with muscle tension. It doesn't hurt. It looks like it does. Yeah. To smooth that out, possibly. I haven't done it for that. There's a whole, well, one of the places is the Acupuncture, a website, Lhasa, and we order all the stuff from that. A lot of things I've gotten from when I went to China or from my school. So. Yeah, well, it's for a month. Just for a month. Yeah. So this helps people who have like shoulder. This is really good for shoulder pain. Uh-huh. Really? The Seneca Falls. Seneca Falls. You know where Seneca Waterloo outlet? Right, you get off of that exit. New York. Yeah. Yeah, Women's Hall of Fame. Yes. There's a community clinic there. That's where I order my herbs from, because it's a whole herbal dispensary. Um, Well, it's the New York Chiropractic College, and inside that college is the Finger Lakes School of Acupuncture. And oh, so you don't want to do, you just want to do pressure? Well, I don't know, but they teach you that too. I mean, yeah, yeah. Or did you find it in New York City? There's probably some there. Yeah. Yeah. So, so yeah, that's Glasha. To help with his allergies and his congestion, I also did a facial massage called Ama, and we use it also for just relaxation if people have anxiety or just stressed out, to help the person help calm what we call the spirit, help calm the spirit. So I'm gonna have him flip over so I can do pet. Yeah, needle free. Yeah. You want this or you good? Okay. So yeah, you gotta come back first. Okay. I think I did one of them all. No, you good. Thank you. Oh, we got prints. Okay. So here, this helps calm the spirit, or if you got headaches. And I'll, do it longer, but it's a whole sequence, and it goes like that. And this helps clear the mind as well. This sequence here is called like the 8. Really good for sinuses. Eye issues too. Someone earlier asked about stroke, to treat stroke, and it does. It helps. Well, so in all, acupuncture is a preventative medicine that helps prevent things from happening if you just come, before something happens. But if it does, it can also help the recovery process. And after you have a stroke, and you might have eye, it affects your eye, your vision, things, or end up having like cataracts or whatever. This can help nerves, bring blood to the eye, and help heal and improve the sight. They do a lot of that in China. There's so much of paralysis and what they call it wind stroke. That's what they call it. If you have the paralysis and the numbing. It's like, and they describe it in the way of being like struck by wind or whatever. But it's like, yeah, the whole unit for that, and it's a lot of good treatment. That would be also definitely internal herbs, and I would probably use more of the Jew scalp. Remember I said there was like ear and fujin. Well, the scalp microsystem would be great for that because it would, it's neurological. It will affect the different sides of the body. So, and then turn the head. And I'm just trying to show you the sequence. So if you got, if you're stressed out and you have neck tension, with the muscle, yeah, the insertion, yeah. Yeah, this will be the gallbladder meridian, and actually the gallbladder is another big one that starts on the outer part of your eyebrow and ends at the end of your pinky toe, and it flows all the way through your body. So because of that, I can treat eye issues on your feet, or it's called distal, or use the reflexology map. Mhm. The ear. Yeah. Some places do, like I said, the community, which will be you sit in a room with, it'll be like this, in a room with other people, and you sit probably in nice, comfortable chairs, but you get treated irregular, so you're not getting on clothes or anything. That's why you be in a room with other people, and it's quicker, and it's usually more cost effective because of that. So. Right, 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 right. And I usually don't. I look at the person's level of comfort. I mean, if I really need, if you experiencing issues where I got to get to your chest or things like that, I'll have you, wear a gown. But usually I let people wear their clothes. I tell them to come in and loose clothing, try to wear tank tops so I can get to the arms, arms and neck or shoulders and things like that, and you wouldn't have to really get undressed. And in a regular setting, there'll be like sheets anyway. There'll be sheets over you. So, but yeah, this helps with the neck tension. And usually people fall asleep when this happens. So, well, yeah. What else? And then there are people who do electric stimulation. I do not, personally, but pretty much everything else I do. So, and that's it. Any other questions? So, yeah, that's a good question. I did, but I changed offices, and right now I don't in the new place that I'm at, but I might in the future. I'm not opposed to that. I don't really like electric stimulation, so, but it helps. It does work, but I don't like the concept of electricity, like inducing, people. There's other ways you can influence the energy of the body or balance it. So. It's a 3-year program. Yeah. And pretty much. Pretty much. It's intense. And you have to be board certified afterwards. You get your license, and you get a master's. But it goes by quick, but it's awesome. It's I wouldn't want to learn any other medicine. So. So. With nutrition, it's actually the same concept of the Chinese herbs as far as what they do. And what they do in China in the restaurants, they cook food in a balanced way. So, if you have, like notice in sushi, they will have ginger or wasabi because sushi is a very cold food coating, especially raw sushi cold in nature, and it's very damaging on the stomach and spleen. So you were supposed to eat it with the ginger to make the balance in your body and so you wouldn't have that damage. And it's the same thing with nutrition. We look at it like, what is it that, not so much what you shouldn't eat, but what you're missing and what you're not eating and need in your dietary life. And just by adding things sometimes makes a big difference in your health. Sometimes we make a joke saying like, instead of getting sick, I could have just, had a apple, and things would have been different. Who knew? Like something that simple would have had a big effect on your body. But sometimes your body just calls out for certain things, and you don't realize it because it needs certain foods in your system. So it with nutrition, Eastern nutrition looks at that and looks at your constitution as well, and by that assessing what foods that you need to avoid because of your constitution, and always add into your diet. So with acupressure, that I do. If you were to come in with just wanting Quena, I would also with the Quena do acupressure so that you can still get the therapeutic effect. So those two kind of go together. And yeah, that's basically it. So did this enlighten you about acupuncture? Okay. So I hope you you know that it can benefit you. And no matter, there's pretty much no condition that you couldn't come in for, or use acupuncture for. Trying to think, is there something? I mean, unless it's more of a hardware type, like, you lost some bones, or, we can help with the healing of a broken bone, but we can't, totally replace, that's like the only thing that acupuncture probably wouldn't do, but, that's that. Well, thanks for coming.